New at noon, we're hearing from the head of the ER department at PeaceHealth Southwest Medical Center in Vancouver. They're seeing a sharp increase of patients with COVID-19. Doctors say this latest surge is driven by the Delta variant, and it's not over yet. Fox 12's Amber Wilmarth is outside the hospital with more on a new program designed to free up beds.
The chief medical officer here tells us it's going to be all hands on deck for the next 10 days when he expects the most recent wave of COVID-19 to peak. Right now, Dr. Lawrence Neville says there are 69 patients being treated for the virus at PeaceHealth Southwest. 18 are in the ICU. He says 95% of them are unvaccinated. As for hospital capacity, he says they're near 95%, but adds they have robust surge plans in place to care for more people if needed. And based on projections, he says they're planning for the number of patients to increase.
We don't think we're quite through this fifth wave of COVID yet. We are expecting, based on the modeling, that the numbers will peak in about another 10 days. And that peak will be at about 90 patients, COVID patients, roughly at PeaceHealth Southwest.
Once we hit that peak, he expects the numbers to plateau for a few days and slowly come down again. He says that eventual drop will be due to ongoing vaccinations and herd immunity. In the meantime, to help free up beds, the hospital has rolled out a new program this week. Dr. Jason Hanley, the medical director for the emergency department, says some COVID patients are now being sent home with oxygen and getting follow-up care there. He says this frees up beds for those who need to be in the hospital.
It has been a very challenging few months for us. It's been challenging 18 months, but the last few months have been as difficult as any. We're seeing about roughly, if you look day to day, around 10%, sometimes a little bit more, 11 or 12, or sometimes 8 or 9%, but roughly say 10% of our volume daily are patients with a diagnosis of COVID. So that is certainly leading to a lot of patients and a lot of sick patients that we're caring for. But overall, our overall volume of patients presenting to the emergency department on a daily basis is what we expect and what we're used to, believe it or not.
He says they're seeing longer wait times in the ER right now. He says partly that's because patients who are sick with COVID tend to stay longer than average hospital patients and take more resources. But Hanley wants to reassure the community that if you're having a true emergency, you will be cared for. And you may have noticed this tent outside of the ER. Hanley says it's to expand the waiting room so that people can keep a safe distance from one another. We're told staffing is playing a role in this too. Dr. Neville says there's a nationwide shortage of key positions at this time, and they're recruiting more staff. And when it comes to staff here and the vaccine, he says they plan to have 100% of their staff here vaccinated by the end of the month. Reporting in Vancouver, Amber Wilmarth, Fox 12 Oregon.